Hello and good afternoon. Welcome today. We are here to discuss driving collaboration in the evolving healthcare workplace. And we're glad to have you guys today. And we're putting together a partnership between Microsoft, Kinley, and Pexip to share with you what we're doing in the workplace. We have a fun-filled agenda for you today. We're going to spend about 2 hours going through some content with you, and you'll also have a chance to ask questions. Now, this is a part of a series that we're putting together that help with healthcare in the life sciences. And here's a blog for you. If you're interested to find more videos like this, just go to aka.ms HLS blog and you'll be able to see this video once it's recorded and available for you afterwards. Now, just a few housekeeping rules that I want to mention. Before we start housekeeping, we want to encourage you to basically to ask questions, be part of the conversation. We want to make sure that you have a chance to, interact with our speakers, have solutions that may be helpful for you in your business. And all of the questions that we have will be basically moderated. So don't feel bad if your questions don't get answered. We'll get to a point where we'll look at it and perhaps someone will follow up afterwards. And we also want to know, if you're having any challenges, any issues, seeing information, or anything that you need to share with us, please feel free to chat it in the blog as well. Now, we do have a Q&A panel that you'll be able to use, so make sure you know about that. And this is what you'll be able to see. You'll have an option to click that Q&A button to get started, and that will help you answer those questions that you might have, and also post any comments that you might have. We're also happy to hear some of those comments as well. And lastly, you'll see those questions here where we'll be able to read that information for you and provide you additional information. So that this is just basically giving you that option where you can have those questions available. My name is Alfred Ojukwu, and basically I'm here to help moderate this, so you won't hear too much from me. I want to get you guys right to the content so you can hear what's happening. So for the agenda, just a high level, I want to make sure we introduce you to our keynote speaker. He's a good friend of mine, Sean Ramakel. I always kind of shuffle his name out. He is the U.S. provider CIO at Microsoft. And he spent a lot of time looking at scenarios within organizations to try to figure out how we can help solve this challenge of the return to work and the return to office and how to balance the two together. So you'll be able to learn a lot from him in terms of what he's seen in the industry and understand what those collaboration strategies look like. So once that's done, we'll go into a few more demos with our team, Frank and Jonathan, and you hear a bit more about that, what those cool toys and demos and solutions look like. And then we'll bring in the experts to really talk about it and get down to the core of what we're discussing with you as a team. So without further ado, I want to be able to pass that time over to Sean Ramakel.
Thank you, Alfred. And I hope you can see the slide. So today we're going to talk about driving collaboration in the evolving healthcare workplace, right? The title of our discussion today. So I'll give you some information about the Microsoft 365 and mostly the Teams environment and how we're affecting change in healthcare. Just as a quick background, I am the U.S. provider CEO for Microsoft, 12 years as an industry executive, but also 11 years as a CIO for a hospital system in North Carolina. So had some practical background, walked the floors of nursing floors and ICUs in my life with physicians and nurses. So I have a pretty good practical background how this can have some applicability. All right, so let's go. So one of the roles for me is to meet with CEOs and executives, understand their corporate strategic plans, and be able to kind of put that into how the Microsoft platform can activate their strategic plan. So I thought I would start with, this is a recent customer I met with. Unfortunately, they had about 50 items on their strategic plan, and we can't share them all. Some of them are highly confidential, but these are not unlike, and it's actually the design they use, of what we typically see. And what I would tell you is that many CEOs and executives really do have the need to really bring their employees together, create cultures of innovation and success. Every executive, probably top 3, has an employee engagement strategy. How do we reach out? As we have, I will tell you, I worked with a large health plan just recently. 60% of their employees are going to stay at home permanently. That's a massive change for them. massive opportunity for teams and collaboration. And getting this all right is really kind of, if you will, right in that one word, modernize. How do we go from, we used to have meetings in conference rooms to with a bunch of folks to now we're going to try and talk to everybody. Okay, so just gives you a feel for what's on top of mind for your executives. Hope you're plugged into that. And these are some things that you can use, I think, to activate that. So Microsoft Teams is the healthcare engagement hub. As you can see here, everything plugs into it and is enabled by it. I think most of these things are probably self-known to you, but for some of those, I'll hit a few items here. Up on the far left, if you're not familiar with FHIR, it is the interoperability standard for data and healthcare, and all Microsoft products can read and write to a FHIR standard. That's a big deal in healthcare. Interoperability is now a federal law as with the 21st Century Cures Act. And then everything else I think is pretty straightforward, except for Microsoft Cloud for Healthcare, which is a really big announcement for us, where we have industry-specific solutions that'll be launched in a private cloud. That'll start October 28th. So please feel free to check back in Microsoft.com and see about what those announcements are. Those will plug into Teams for sure. Okay, so let's talk about the first step, employee engagement strategies. And I usually, when I talk to executives, I have to keep it high level. They like storytelling. So these are kind of the slides that I actually use with executives, and hopefully this makes sense to you. The first one that's often overlooked, especially plugging into the Teams environment or just generically as well, is Microsoft Stream. As you can see here, we worked with Baycare out of Tampa. They embrace Stream as really one of their CEO's prime methodologies for employee engagement. He recognized that many of his nurses and ancillary folks are now millennial Gen Z employees. And they're much more used to picking up a phone and consuming a quick video bit than reading an email. And as you can see here, their old methods of email were pretty much not used, right, are hardly opened. And since they've implemented Stream as Baycare TV and they've made it fully a production environment, they've been able to bring in other channels for the chief nursing officer, quality, their mission teams, and as they're bringing on new organizations, which they do, they can also have subscribable channels to that. That's really blossomed for them, and again, their CEO is really significantly involved with that. I will tell you another one. I'm not a customer that's not Baycare, but I have many executives who still, especially in providers where there's still a lot of people at work, right? We're taking care of patients who like to manage by walking around, a really popular management strategy. And so with a mobile phone, they are quickly just producing a 30, 40-second video on the fly, congratulating employees and making sure there's praise, honoring people who are on the floor for the hard work that they're doing, the hours they're putting in. That's super spontaneous and viral. It shows your executives are out on the floor, they're integrating with their employees, and they're not just sitting in an ivory tower or at their desk. All right, so that's Stream. The other one that's often very popular, and this is Cerner, the electronic health record company, developer, integrated software developer vendor. They widely use Yammer. I think Yammer is often overlooked as sort of the open door strategy. Many executives will point to, we want to have more communications with our employees. We want everyone from the bottom of the organization to the top to have input to how things are going. HR specifically looks for those type of things anymore, and with large organizations, you have areas of expertise. We even see it in Microsoft, even Microsoft Health Life Sciences. Some of us are CIOs. I work with people who are nurses and doctors and pharma specialists. We all have our expertise, and so finding those and being able to interact with them, or us being to share knowledge out to a broader group of people is super important. So Yammer is is really this internal social network for your organization, and it really, in a thoughtful way, in design, you can actually have these rings of communication within different groups, whether it be your clinical people, your business people. It could be around specific projects. It could be around certain topics. It could be just for fun things, people who get together who have certain areas of interest, right? It could be sports, it could be hobbies. Yammer really does allow people to come together and find other people. I can give you a personal example. I had a customer ask for how Microsoft delivers education, and within about 10 seconds, someone on Yammer told me where to find it. I found it, and I could deliver it to the customer. In a Microsoft organization, that would have been nearly impossible 2 or 3 years ago. So if you try to expand your employee engagement, certainly look at Yammer as a way to reach the entire organization. And the last one I'll talk to here, which is incredibly important during these times, and in fact, up until July, Microsoft Live Events even allowed up to 100,000 people in an event. I'm not sure if we've extended that, not my particular space, so someone else could chime in on that later in the Q&A. But if you think about what we're doing today, we're in a live event. We can support up to 10,000 people for sure, and deliver either education or town halls. If you have an executive who needs to reach out to everyone in these uncertain times, especially when things are changing rapidly, whether you're working from home or you're working in the office, this ability to reach out and have interaction. You have Yammer Q&As here on the side. We actually even have, as the videos get uploaded and available for people to consume later, we have AI, right? We can turn all of this speaking that I'm doing today and Alfred and everyone else into a transcript that's searchable, right? So AI is embedded into what we do. And this is a really great way to drive engagement. I know personally, I'm involved with live events on a pretty constant basis. And the engagement levels, both for internal employees and education that we do, it's one of the jobs I'm responsible for is education. It's a wide amount of engagement, hundreds and hundreds of people, right? So don't overlook these three areas and integrate them into either your team's environment or overall organization. Your executives and your senior leadership really do want to find ways to reach out to their employees. Okay, culture of innovation. So once we bring these communities, we got to be able to share knowledge and expertise, right? The good news for everything that we've shown here, we go back to that hub methodology, is that Power BI and all of the components that you saw here easily flow into Teams environments. Just add a tab and have a conversation. So whether you're sharing, in this particular example that we're seeing here is for physicians. Unfortunately, it's for anesthesiologists who arrive to surgery too soon to start billing before the surgery begins. So they're tracking that excessively early because that costs people money when doctors are billing and no one's in the room. So we also see, if you're in the mobile example, virtual tumor board. So we have very expansive solutions that are being developed in the Teams environment, and whether we're sharing analytics about what the department or the group or the division is doing, or we're just having physicians doing a virtual tumor board or a molecular tumor board. The ability to collaborate, even if they're separate. If you think about what a virtual tumor board is, typically oncologists and physicians are working across organizations. It's not uncommon that you'll be working with physicians from maybe 2 or 3 other hospitals at the same time. So a great example of working remotely to improve clinical care. The next one, probably often overlooked, but I will tell you that the executives that I talk to get super excited about this. I was a CIO. I managed programmers for a living for a long time, so I have a great appreciation for what developers do. But often your citizen developers, your business analysts, your Excel jockeys, and all those folks for back-end departments really are closer to the business processes. And not everyone needs a fully functional development environment to build something to solve a problem, whether it's getting some data, eliminating paper processes, getting rid of manual data collection by putting it on a mobile phone. This culture of innovation that executives want to do, or chief innovation officers, I speak to them often. This environment, Microsoft Power Apps, which can then be folded into the Power App, right into a Microsoft Teams, so you're enabling the people who need it the most. They don't have to go search for this, is super powerful. I'm not a fool enough to know that there's no such thing as no code, but there is a lot of low code solutions that can be done. And then most of the commands in Power Apps, I haven't built them myself, are very Excel-like. You have some basic understanding of Excel and how to manipulate data. You can build an app, and a lot of them are pretty functional. So we see constantly what I would call enterprise applications that are pushed out, but we also see a lot of departmental. So if you're working with your chief innovations officers or your executives and you're hearing this about culture of innovation, certainly look at Microsoft Power Apps. I know a lot of people get hung up on governance and managing this. We do have models that someone can certainly speak to you about how we can manage that. It is not everyone doing their own thing. It's not the wild, wild west. Okay, so frontline managers, we talked about the executives. So what do we have in the Teams environment that can facilitate secure messaging, right? There's a vast amount of tooling that has been brought to the Teams environment that really enable clinicians and others to work really effectively. All of this is covered by HIPAA and HITRUST. I hope you caught those logos on the first couple screens. This is what we do. It's the certifications that we know are needed in the healthcare space. So many clinicians need priority notifications by law. If I send a notification to a physician, I need to know that they've read it or that someone's read it, which gets the next step, message delegation, read receipts. All these are very important. I cannot send a request to a physician, say, do we need to change the drip for patient Sean Raymackle to 10 milligrams? Need to know an answer, and I need to know that someone else is going to get it. I can't just assume that those things are out there and someone's going to read them. And then lastly, federated messaging. Again, we've talked about organizations working across barriers. This often happens in the provider space, but also with plans. Plans have many provider networks. So you have trust that you have with some of these other organizations. So you can bring that all into the Teams environment as well and create, if you will, rings of trust for your employees. They may have their own internal teams, but they may have a team plus external folks. Great way to continue share files, share messages, take actions quicker, right? And then lastly, targeted messaging. It's nothing more annoying to clinicians, especially on multiple shifts where people are changing, and that's not uncommon in the clinical world. How do I get a hold of, say, the radiology scheduling coordinator? Who is that person today? That might have a lot of turnover in that job. So with targeted messaging, you can just develop a title, radiology scheduling coordinator, and whoever is in that pool of people, you can target that message, they'll all see it and they can respond to it, right? You can do that by roles, skills, or just team affiliations. Okay, so we'll get into a little bit more of the advanced course here. So Teams is quite an extensible solution, and where many of our customers do the rollout, they implement chat in Teams. I often get the question, so now how do I bring my clinicians into this mix? How do I enable my business processes? So I'll let you know, there's a little bit on the front screen as well. The Microsoft bot framework can be brought into the Teams environment as well as actionable messaging. So if we come back to this discussion about FHIR and interoperability, and I mentioned to you that our environments can read and write data, healthcare data through interoperability standard, then you can start to build messages like you see on the screen here. For example, readmissions is a big issue for providers. And so I could let someone know that someone's been just admitted to the hospital, and someone who's responsible for readmissions and maybe trying to avoid them before we admit them to the floor from the emergency room, maybe we can do some disintermediation and try to change the course of what's going to happen next, right? But we don't have to reach back out to the EHR to do it. We have these action buttons that allow me to pull data that already been pre-coded for this particular patient. So these type of workflows that include bots for fetching data, FHIR interoperability so you can bring an electronic medical record, really important to build dynamic flows for your teams and support, if you will, not the classic clinical care, but the back channel communications that happen all the time, which is what's happened to my patient, what do I need to do to schedule my patient. Most of those things are not captured in the electronic health record. They're not required to be. So alerting and actions are really big important. They have a wide range of opportunity. As you can see here on the bottom right, you can even build a bot to look up ICD or CPT codes or DRG codes if you want to. So they can be quite simplistic, just fill in a bunch of data and put it at people's fingertips. Okay, so I mentioned in the strategic plan, many of our CEOs do a lot of M&A. I have one that probably buys 10 different businesses a year. So this is kind of an active discussion that we have, at least at the executive level. The Teams environment and all of this content that can flow into the Teams hub, if you will, is really powerful for the M&A business process. You need lawyers to be in an environment where governance and retention and all these documents, whether they stay together or they break apart and they don't come together, all that needs to be in there. So all that due diligence, pre-negotiation activities can be done in different channels. In fact, you can have channels for legal, HR, IT, all those folks have to do the crosswalk with the acquiring organization to understand what are we going to consolidate, how are you working today, how we might work tomorrow, right? And so all that co-authoring of documents, sharing of files can be done in a really secure environment. Now the big days come, we've merged, we got to get the word out, right? So we talked about live events. What a great way! 10,000 people, all in different events, maybe scheduled throughout the day across different time zones. And the two CEOs come together and share their vision of where this merger is going to go. So all of the tool sets that you need to actually facilitate something as difficult as a merger and acquisition are all provided within the Teams environment and the M365 broader environment. Okay, and my last slide here, and a little early, is best practices. So one of the things there is an easy button. Leaders have to drive the culture. If you're like, I get super excited by executives, like I mentioned earlier, when I show them Microsoft Stream, and we talk about the idea of just using your mobile phone wherever you are to knock off little 30, 40, 50-second, 1-minute videos when you're out and around with your employees. Look, I don't expect executives to be like on TikTok, but everyone understands that culture of sharing as caring, right? So leadership needs to drive it. They can't just sit back and say, let's push this down the organization and let the Gen Zers do it. That's not going to work. If you're going to talk about an open door policy, then facilitate the tools to create an open door policy. Be willing to listen and respond timely to your lower level employees if that's what you want to do. Otherwise, it's a bit farcical. And then lastly, in a current environment where many people are working from home, as a leader, demand respect for quiet hours and time zones. I'm an East Coaster. I support people on the West Coast, and oftentimes you have to remind people, I on an emergency, yeah, I might be able to take a phone call at 7 o'clock at night, but let's try not to make that a normal occasion, and I won't bother you at 5 in the morning. So there's a level of respect that has to be built up when people are out of the building. And then lastly, my favorite one, I hashtag this all the time with my own team. If you want to build community, work in the open. You are no longer all in the same room. Or at least a large of us. Some of these folks are going to stay at home for a long time. It can be very difficult for folks who've not done it. I've been at home for 8 years, so I've built my environment to know how I want to work. But we have these Teams environments, and people don't share. And so no one knows what's going on around them, and no one knows what's being created. Like this deck that I built today will be shared with my team. I don't know who's going to use it or if they'll even use parts of it, but it does spur conversations. What was the conversation about? Who were you talking to? Can I use these slides? If you don't work in the open and you don't share spontaneously and often, then the team site is just a place to put a funny GIF. And that's not collaboration, okay? And then lastly, if you're a frontline manager, like with any good frontline manager, acknowledge those who share. If you want this to be best practices, if you want this to be organically growing, then whether there are people working in the office and are people working at home, make it be fair, let everybody encourage the sharing and certainly layer on the praise, okay? And with that, Alfred, I'm gonna turn it back over to you. That's the end for me.
Excellent, excellent. Thank you for sharing that information. I really appreciate it. I think it's great to hear that, just the content you're able to share. I think it's important to understand where we're coming from. And hopefully if they have questions, we'll be able to reach out to you and ask, Again, our goal is to make sure we give you guys a chance to, be a part of that conversation and learn about what's going on in the industry today. So let's keep moving. We do have some additional content we want to share with you. It's going to be great because it's around some of the newer technologies that we have. So let's take a look at that as we go into this, because I think it's important to understand just how do we apply what Sean is talking about. And these are things that we're doing today, right? These are ideas and solutions that are being put in place within the industry. And let's just watch this video because it takes you through that journey. Now, this is one of our experts that basically shares exactly how we're taking technology within the healthcare space and moving forward with it. So let's take a look at that.
Let's take a look at how technology needs to slip into the background to allow medical professionals to provide quality care to their patients. I'm Brian Westbrook. Coming up, we'll take a look at remote collaboration and consultation with specialists. We'll also look at Power Apps on the Surface Duo, and we'll chat with Clifford Goldsmith, Chief Medical Officer for Microsoft US. How has the current climate changed the demand for telemedicine, the demand for telehealth, and what products and services are helping bridge that gap?
Before the pandemic, virtual visits were already something that was available in the industry. People used it. Suddenly, with the pandemic, because people were now socially distanced, had to isolate, were anxious about getting out, virtual visits became imperative almost. And we saw a rise. I think the figures I've seen from American Telehealth Association is about 14% of visits became telehealth visits or virtual visits. And the product that Microsoft has that supports televisits is our Teams product, which allows us to really communicate effectively with patients or with other clinicians in a consultation environment. What's not happened up until now is we haven't moved from virtual visits where we are today into what we're all calling virtual health, which really requires adding more information to that environment in order to be able to continually care for that patient wherever they are. And so very excited to be here with this Duo because I actually begin to see the potential for this device in its size that it is to easily go into a pocket of a jacket like this or into a pocket of a white coat that you can walk around with. It also connects as my phone, but what I really like about it is it has more real estate on the screen.
What are the
Okay, so that shares, just wanted to make sure that you had a chance to see what that looks like. Now, we have a longer version of that. We'll share it with you afterwards so that you can get a chance to see what we're doing with technology. But now we want to take you to the more live demo discussion around how we're actually solutioning this. Now, the importance of this is because that transition really shares with you the idea that we're taking these ideas, these concepts that Sean just mentioned to you, and bringing it to life and really talking about how it's being leveraged in the industry today. And so with that, what we're going to do is we're going to bring my buddy on, Frank Buchholz, and he will be able to share with you exactly how he's using that technology to change the world even.
All right, so I want to welcome everyone, say thank you for taking the time to watch our webinar here. The thing I'm so excited about is I'm here in actually my living room or my den or basement with a bunch of Surface Hubs. I've been giving demos out of here ever since the beginning of the COVID pandemic. I essentially almost live down here. I think my wife slides some food under the door every once in a while, and I sleep on that couch back there. But it's exciting to be able to, as Alfred said, try to change the way that we look at this hybrid work model. As we start to return to work, and Microsoft actually made its own kind of pretty powerful statement this past week in order to say, give the flexibility to employees for them to decide their own work-life balance by deciding whether or not they want to work in the home office or whether they want to work in a corporate office. And there's a hybrid there, right? There's a hybrid in that they could essentially choose to come into the office for collaboration and communication when we need to get work done together. But when they're at home, that's more about concentration. How do I get my core work done in order to have a concentrated area in order to do that? And how does a workspace try to start to evolve into those types of spaces? Well, personally, I think the Surface Hub is a big part of that. A big part of when we build out these ecosystems and these environments in the modern workspace and these hybrid workspaces, how do we start to turn the Surface Hub into that type of space that you come in to collaborate and communicate with others? Odds are when you walk into that space, maybe only a few of your coworkers are in the space with you and the rest are all remote, but you want to make them first players. Essentially, you want to make them just as much as important as part of that meeting as if they're remote, as if they're actually in person. And how do we use the technology that's available in order to do that? Well, so part of that is to introduce some concepts around what we're doing on the Surface side and the Teams side. Within this space that I have, you see this big, beautiful 85-inch Surface Hub, and we can start to think of this as maybe a cornerstone to that meeting space that you come into your office space in order to do that communication and collaboration. But what we also have on this side of the room is a Microsoft Teams room. Now, I know this looks a lot like a Surface Hub, but I'm actually just using a Surface Hub, in this case, as a LCD for a Microsoft Teams room. It's probably the worst case scenario of how you could use a Surface Hub from an expense standpoint, but think of that as just a standard LCD with, in this case, a poly MTR connected to it. Now, the MTR essentially brings together things like presentation as well as video teleconferencing, but the Surface Hub brings an element of collaboration where you can actually work together to co-author or communicate together on combined documents. I actually want to join a meeting and show you that if we were using the 85-inch here, essentially in order to do something like training, maybe in a healthcare environment or a university that is about a medical center, in order to learn about maybe, in this case, the anatomy of the human body, how can I pull people into this meeting very simply? We actually have a technology called coordinated meeting that allows us to pull together a Microsoft Teams room as well as a Surface Hub into one space in a combined manner, meaning that we balance the microphone and the speaker and the video all across these two devices through a defined file that they both share. So let me go ahead and give you an example of that. I'm going to walk over to my Poly MTR and I'm going to hit join. And when I hit join, you'll notice that on the MTR, I get essentially the people's faces start to pop up. And maybe Jonathan, could you let us into this meeting? I didn't realize that it would prompt for that. So let me make sure. I don't know if you're seeing that, Jonathan, to let us into the meeting. I can walk back here in case you're not hearing my audio.
Yeah, just did it, Frank.
All right, thank you very much. All right, so what we're seeing here is across these two devices, we're starting to see, and then if you could turn the spotlight off, is the spotlight on me? So in this case, we're hitting some interesting technology pieces here. So what I can actually do here is I can make this so that I can share this degree of video content across both devices. And so here I have a number of famous TV physicians that have joined us on this particular call. And what I actually had take place was a coordinated meeting across these two devices. I'm sharing now the audio, video, and camera capabilities across these two devices, so I select which one I want to pick from each. I always like this picture. I always describe this as these are three actors that play physicians, and then one physician that plays an actor. And I'll let you decide how those work in that space. But what I really like about this is I can walk into this space and clearly see these physicians here in order for me to interact with them. In an 85-inch environment, and much like a home environment, they feel more like they're actually in the room with me. The only thing separating us is this pane of glass. And I can easily see Jonathan interacting with me towards that. I can also dock this content and be able to have them on the side, but then come into something like I'm interested in the cardiovascular system, and in this case, the heart. And maybe I'm interested in sharing this content with them and be able to come into the heart and be able to actually dive into this particular, say, the Artemis on this, and be able to show you some degree of diagram for me to actually manipulate this content and be able to share it with people that are just as much remote as they are live to this particular segment. So that shows you kind of this environment where I can easily walk in, one touch to join, pulls in a Microsoft Teams room, pulls in a Surface Hub. I'm easily able to share content with them, and I'm able to get up and running in a matter of seconds rather than the minutes it normally takes to actually join a meeting. The other piece would be is I'm going to hang up out of this device. And you'll notice when I hang up off this device, it actually hangs both devices up. It ends the meeting in this particular case on both devices. What I'm going to show you next is something on this particular Surface Hub on this side of the room. Now, this Surface Hub is unique because it has an integrated battery from APC. If you'd actually take a look at the device, and I'm going to go ahead and move the camera over a little bit so you can actually see the device a little better. And so if I come over to this side of the room, you should be able to see that this device has not only a Steelcase Roam stand, but it also has a battery that's integrated into the bottom of the Roam stand. The battery is from Schneider Electric, or ABC, and allows us to turn any space into a collaborative workspace. So what I want to show you is I'm going to pan the camera back in this point and be able to bring it back into the middle of the room. But I'm going to reach back here and actually unplug the battery or the device from its AC power. And so now I'm actually running on DC straight off of the battery. And so I'm going to roll this device into the middle of the room so you can see it a little better. So hopefully I'm framed out okay, because I only have a small little preview window of what I can actually see, but I think you can see me pretty well here. So what I have here now is this Surface Hub that, like I said, I can run for about 100 minutes, and I can literally roll this into any space. I'm going to pretend that I'm going to roll it into a patient's room, and I want to be able to roll this into a patient's room in order to give them a consult, but I want them to be able to join this meeting, and we'll join this meeting because we want to be able to bring their family and maybe some other physicians, as well as some remote physicians into this meeting, so we're able to have a proper consult with a particular patient, and pretend you're the patient in this case. What I really want to do, though, is I want to join this meeting through what we call proximity join. I want to be able to walk into this space, and I don't want to have to touch the device in order to join the device. I actually want to use my phone to join the device. You can think of this also as I'm late for a meeting, and I'm already on the consult, maybe on my phone, and when I run into the space, I want to be able to transfer the meeting to this particular device. So I'm going to pretend that you can see what I can see off my iPhone here, but I'm going to go into Microsoft Teams. I'm going to look for today's date, which is the 21st. The day after both my son and my mom's birthday, interestingly enough. And so I'm going to, at this point, join the meeting here on the 21st. But instead of hitting the join button, I'm going to hit the down button off of here, and I'm going to hit add and join a room. Now, the device will send out a Bluetooth beacon that will look for other Surface Hub devices or Microsoft Teams room in my space. And essentially what I can do is I can tap on that and now hit join. And you'll see that behind me, the device will actually join the meeting and be able to pull me into the meeting without even having to touch the device. And so that brings me into this meeting through what we call proximity join. And know that this works for Surface Hubs as well as Microsoft Teams rooms to be able to transfer a call from, say, your phone to the device. And so now, again, I could come in and actually bring up this content. And we have, again, our physicians that have joined us for this consult, as well as Jonathan, who I believe is on the call somewhere as well. So hopefully that worked. So I hope that Jonathan didn't, we lost Jonathan at some point, but within here, we'll keep moving right along. So within here, what I really want to do, there he is, Jonathan's back. And so I'm going to dock, hey, Jonathan, how are you? Hopefully that made sense. And so I can now move everybody off to the side panel. What I want to actually do now is actually authenticate to this device. Think of this device much like in a healthcare environment where I need to easily authenticate to the device so that I can get to all of my Office 365 content. So the way that I'm going to do that is through a passwordless authentication means. I can actually walk up to the device, hit My Meetings and Files, and hit Sign In. And when I hit Sign In, I'm actually given a list of users. I like to think of this like Avis Preferred or Hearst Gold. There was legend at one point in our lives. We flew on these big steel bird things that we like to think of as being called airplanes. I know that's legend that we maybe flew on those at one point. And they would land at these things called airports, and we'd walk across the airport and walk to a rental counter. And when I did travel, I think it was a dream, but it was so long ago. But when I did travel, I used to go up to the counter, but they'd say, Frank, you travel so much. You're Avis Preferred. We put your name on a board. We put the spot where your car is located. You don't have to sign anything. Just go straight to the car, show your ID to the gate attendant, and keep moving. Well, we tried to simulate that here as well. So what we can do is I can hit Jane Demo. And when I hit Jane Demo, I can hit Continue. I'm going to pretend to be this person called Jane Demo for a few minutes. And now instead of getting prompted for a password that I have to enter on the screen, I actually get where it says send notification. And that's because Jane Demo is set up as an Azure Active Directory multi-factor authenticated user. Now that is a mouthful that you do not need to memorize unless you're an IT admin. But what that really means is send a notification. We maybe hopefully get it. Send a notification to the iPhone so that I can log in through the iPhone instead of having to log in through my password on the screen. So I hit the Authenticator app and I actually log into it. Now there's a number on the screen that says 65, and there's also a number on the iPhone that says 65. So I match that, and now I go ahead and hit my fingerprint to provide a second form factor of authentication. Now that allows me to have authenticated access to the Surface Hub. And I have now ability to have this device as my own device, and I've achieved what's called single sign-on. Single sign-on means that I now have access to every application on this device as my own through Office 365. So if I opened up Word or PowerPoint or Excel, I would see all my most recent files in each of those different applications, or any other application that is supporting single sign-on as well. So in this case, I'm going to hit done, and it's going to pull up my most recent files. So one of those files is a patient record. So imagine I'm talking to you now, you're our patient, and I'm going to go ahead and tap that patient record, and it's going to bring it up so that I can now have that on the screen. And I'm going to go ahead and be able to bring that into Microsoft Word in this case. But you can imagine this could be any application that uses single sign-on in order to get to your records and other pieces. And so now we have these records here. We have some lab results and a history of you as the patient, then how you're doing. And we're in your room, and we brought some physicians into the room with us, maybe as well as some loved ones that want to be able to hear this consult as well as it's taking place. The other thing that I have is I have essentially a whiteboard here. And so within the whiteboard, I have the ability to bring in other people onto this whiteboard. And so I can hit this button here, and I actually have the ability where it says write and search for a person. Well, I know that Dr. Lickus, Jonathan in this case, is on the call. So I'm going to come in here and write Jonathan. And when I write Jonathan, I can now invite him straight into this consult that we're doing. And so he's now been invited, and he will be able to go into his own version of this Microsoft Whiteboard, whether that's on a Windows 10 device, or it could even be on an iOS device like an iPhone or an iPad. And it will actually soon run on Android because we released this Android device called the Surface Duo. And actually, Jonathan's going to do quite a bit of a demo coming up around the Surface Duo towards that. Now, one of the cool things that I could do is imagine you're in here for some heart pieces. And so I can come back to the lab results, and I can actually cut those lab results and be able to pull them straight into that Microsoft Whiteboard. And so now I have these lab results in the Microsoft Whiteboard where Jonathan could actually circle and highlight any of the different pieces of content that he says are, might be something that we need to look out for. The other thing that I could do is while he's jotting down some notes, and he's remote, literally he's down in downtown Seattle, I'm in Kirkland, Washington, and our patient is here in Kirkland, Washington, or wherever you are. But what I can do is the other thing that I can do is I can actually come in here and look into this Bing library and be able to write in heart diagram. So I'm going to write heart diagram. And when I write that, it'll actually search the Bing inventory for different heart diagrams that I can pull in. Now I'm going to tap in this one and be able to add this particular heart diagram to this piece. But now this is just a picture. And what I really want to do with this picture is be able to turn this into something that Jonathan and I, as your consulting clinicians that are in this different space, we really want to come in and be able to turn this into something that we can edit. So I'm going to use what's called ink grab within the Microsoft Whiteboard to turn this into editable text. And so we're actually concerned about the right ventricle here. And so one of the things I could do is I could highlight this particular content and then be able to maybe erase that different part of it and come in and say, look, you're having a little collection of blood in your heart down here, which I guess is normal. But it would be that there's not enough evacuation of blood. So we're going to have to do some degree of surgery in that particular space. And Jonathan, you're on the line, right? And so you could actually come in and Jonathan could write in there that this is the maybe the stint or other piece that we're going to do. We are way out of our bounds on any healthcare knowledge here, but we're pretending to be doctors and physicians in this particular case. But you can start to see that within Jonathan's ability to add in audio, and I think if I was to turn up my microphone on this particular device, and Jonathan, can you hear us now or hear me now? Yeah, so Jonathan's actually looped through the call, so I want to be careful on that one because of the but I'm going to now be able to say, hey, we've been able to have all these different pieces. We've been able to review patient records. Jonathan's been able to talk to the patient straight from the device itself, whether we make it full screen or other pieces. And then he's also been able to share. And so, Jonathan, do you want to share your Duo desktop to me so that we can actually see it through this call as well? And so when Jonathan shares his desktop, I could actually see something off of his device that's remote that he's actually sharing in through the call as well. So I'm not sure if we were planning to do that. Maybe actually we weren't, but there we go. So Jonathan's actually going to take over the screen at this point, and he can actually now share what's actually he's seeing on his side on his Duo, because he's actually starting. He's been joining this meeting through his Duo, and then he's been able to share the screen of what he's seeing back to me. So he can actually go into the Duo and be able to actually show some piece of content that he has that he wants to share with this patient as well, because he's remote. So not only can he share his face in this case, but he could also share any content through this screen that we've now rolled in essentially on a battery into this particular space. At this point, I think we're going to kick it over to Jonathan and allow Jonathan to take over with the rest of the demo and be able to carry on this particular presentation.
While we're doing that, we do have one question for you, Frank.
Sure.
The question was around ambient noise, and the question is, working from home can be challenging at times, especially with ambient noise within the home. Is Microsoft or is there technology targeting this that would essentially help from a roadmap perspective?
Yeah, so one of the unique things about the Surface Hub in this case is it uses a directional microphone capability. The Surface Hub has two different microphones, as well as most Surface devices in this particular case have this as well. So whether you're on a Surface Laptop 3 or a Surface Pro 7 or a Microsoft Surface Hub, know that we use a dual microphone capability, or that we call studio microphone, that literally locks in on you as the active speaker. So it has a beam shaping algorithm that can find you as the active speaker and echo cancel out all that other noise. It's important that you look, when you're looking to purchase your next PC or even a meeting room solution, that you buy technology that can actually have that directional microphone capability built into it. Don't look for just devices that have a single microphone. Look for devices that have dual microphones that can actually find you and use a triangulation algorithm in order to echo cancel out all the other noises. So that's an important piece. So great point.
Excellent. And will headphones help out in that situation as well?
Yeah, absolutely. And I see like our Samantha that's on this call, she's wearing a headphone as well. And so being able to kind of lock in on that particular sound source, and so you're not being distracted by all those other pieces, certainly helps as well. So I know we build a Surface headphones, but there's many other headphone solutions, as well as even the Surface earbuds that you can purchase as well, that both have these echo canceling capabilities. And if you actually, Marcus Brownlee did an amazing review of the Surface headphones, and the thing he likes the most is the actual swivel mechanism and the kind of the build quality that's on it, and the ability to kind of dial in and out the amount of quality of ambient noise cancellation that there actually is in the market space. The one thing that we would say that's unique about Surface headphones is they are geared for human voice and office types of ambient noises. One thing we've learned when we were building that is that, say, the Bose headphones are actually built more for air travel and air travel kind of ambient noise cancellation, where our Surface headphones are really built more for office cancellation of the types of noises you would hear in an office. So it's interesting that our audio engineers are able to tweak it down to that particular level. All right, so I think we're ready to kick it over to Dr. Jonathan Lickis. He plays one on Teams calls. So.
Yeah, great. Thank you so much, Frank and Alfred, and hi everyone. Just before we get started, I just wanted to say I hope you're all doing well wherever you are, and to you and everybody in the health profession, just a big thank you for everything that you're doing to help people keep people safe given COVID-19. So I'm just going to switch over my camera so you can see my device here. People are increasingly using smartphones for work, but we did see a piece of research that says that 72% of people struggle to stay productive with a smartphone today. So the Surface team within Microsoft started envisioning how we could help with that. And through research and prototyping, we actually found that 42% of people saw an increase in productivity with a dual screen device and having that ability to have two screens to separate content. And so it was really that inspired us with the new Surface Duo product that I have here, that we came out with a couple of months ago. You can see that it is extremely thin. When it's open, it's just 4.8 millimeters thin. It has a footprint of physical size that's just a little bit bigger than a single screen phone today. It's super light at 250 grams as well. So great that it has that pocketable form factor, but it's really solving that problem of increasing people's productivity on a device that can still fit in their pocket. So you can see here I'm on the lock screen, and actually we have a built-in fingerprint reader on the side of the device. So I'm just going to hit my thumb on the side, and you can see that it quickly signed me in to the device. Now, this is our first Surface device from Microsoft that's actually running Android 10. But the way that we've built the launcher experience, the main UI that you see here, is going to make it extremely familiar, not only for Android users today, but also for people who are familiar with Windows. And you'll see some of that throughout the demo. So, here I'm on my home screen. There's the familiar kind of look and feel of different pages of apps that I can swipe through. Because this device is running Android operating system, it means that you can get all of the apps that you need from the Google Play Store. And so you can see here that I've got a couple of the leading apps used within healthcare, like Allscripts, Epic, Cerner. All of those work on Surface Duo. Difficult to demo though, of course, without a license and an account, but you'll see some of the functionality of Duo that would really make all of those apps and experiences light up. And the great thing about the design of the device as well is this 360-degree hinge that still, even when I'm holding it with one screen, is pretty robust. Like, it doesn't wobble around, yet I can move it seamlessly through different postures. And I can really easily just fold it all the way back and actually put it into single screen mode. And now you can see just how familiar this experience would be to people who have not used a dual screen device before. So the first, diving into some of the experiences that you can do with Surface Duo, I was just in that Teams meeting with Frank. And so by loading Teams and going ahead and joining that meeting here, you can quickly see that I can easily get into a meeting in one screen. I can make eye contact with Frank and with the other people who are in the Teams meeting, just as Frank was showing, but I still have the other screen to do other things with. I can even pull up the main Teams app so that while I'm in a Teams meeting and call, maintaining eye contact with patients, with other clinical providers or partners in my office that I want to ask for advice, I'm able to get access to the information and things that I need to help guide that conversation. A great example of that is, quite often when I'm on Teams calls and I'm needing to either present some information, or maybe I'm asked at short notice, like, hey, can you try and find that piece of information? There's a great benefit there to still being able to see meeting participants, still being able to see the context of maybe what's being shared, but still do something else. And so, I'm imagining that one of these people has just asked about, some of the latest guidance from WHO around maybe hand hygiene, and I can quickly come in here and flick through this PowerPoint. The other thing that Duo in a dual screen device allows us to do is really intelligently look at how we use the two screens. So if I take PowerPoint here and actually span it across both screens, I now have this intelligent view where I see a large preview of the slide on one screen, and on the other screen I actually see the slide sorter so that I can quickly jump around to find the content nice and easily. I can even turn my device into dual landscape mode, And with the 3:2 aspect ratios of the screens that we have, and each of these screens is 5.6 inches, it makes it great for being able to dig into the detail and really clearly see what's on the slides. And at the same time, my Teams meeting has this picture-in-picture down here, so I can still know that people are paying attention on the call. I can still feel like I'm having that very human, person-to-person eye contact, reading body language interactions with, patients or with other physicians that I'm trying to have a conversation with. The other thing that I quite often do while I'm on Teams calls is to want to take notes. There's lots of research out there that talks about the benefits of being able to handwrite and how that sort of sinks into your memory better. And so by pulling up an app like OneNote, for example, and grabbing my Surface Slim pen here, Duo fully supports ink. And so, I'll just write you a quick hello message there, but you can see that Duo fully supports ink, and so great for being able to use natural handwriting in order to quickly make a note of things. The eraser even works just as you would expect it to with a real physical pen as well. So moving on, I'm going to leave this meeting now. Just one of the other scenarios that I wanted to show quickly is Outlook, while I kind of quickly close some of those apps. I think email is still a prevalent task for many of our different roles. And so, here I'm in the Outlook app. I'm able to clearly see my email sorted really nicely and displayed really visually for me. I'm going to go into this this email here, where somebody could be asking me to take a look at the latest media briefing because they want me to provide an update in the team meeting tomorrow. So I'm going to click on this hyperlink to start checking out the video. And normally this would take you out of your flow and the context of the email and what they've asked you to do. But see that when I open this link, actually what it's done is automatically load that video on the other screen. And now I can watch this briefing from who. I can actually turn my device into dual landscape and fold it down. And now, thanks again to the hinge design on Surface Duo, I can use it in tent posture, being able to set it down as I'm either walking around the house, I'm in my office, or I'm in the coffee making area, and I can be productive in all of those different environments, kind of hands-free. I use this feature so much, not sure if I should admit to this, but given how busy we all are now working from home, making lunch or making dinner in the evenings, this is a great way to stay connected and be productive while not having to balance and lean my phone up against the backsplash there. So I'm going to go ahead and exit this, and of course great for training and learning as well. You can also see here, one of the things that this person is asking me to do is provide an update on the guidance that's been provided in that video in the team meeting tomorrow. I don't know about you, but keeping a track of everything we're being asked to do in these busy times is difficult. And so I actually use Microsoft To Do to just help me keep track of all of the different tasks that I need to do throughout the day. Normally, doing something as simple as wanting to copy and paste some information is a pretty onerous task. You have to press and hold and select the text, then hit copy, then switch apps, then press and hold where you want to paste it and actually hit the paste button. Well, again, this is an area where, thanks to this being a dual screen device, there are innovative new ways that we can allow some of those basic processes to become even more streamlined. So, I'm just going to select some of this text here that's asking me to provide an update in tomorrow's meeting. So I'm just let's just say that I selected that part of text. And now with my finger, I can just select this, drag it across to my to-do list. And actually this gets added as something that then later on today, as I've prepped for it, I get the really satisfying job of ticking off my to-do list and quickly staying on top of all of my tasks. This is especially, important for, nurses, busy physicians or healthcare professionals, that, staying on top of all of the things that they need to do throughout a day that come up is really crucial for, delivering fantastic care in a timely manner to patients. Just the final scenario I then wanted to show is that, obviously within healthcare, patient data and data in general being kept secure and confidential is a massive, thing of importance. And so the other ability that we have here is to go into the remote desktop app on Surface Duo, join this Windows Virtual Desktop session. I'm going to try doing that again because I should have signed in already. So it's going to sign me into a Windows Virtual Desktop session. And you can see now that I'm actually in if I just minimize this, I'm actually in a full-blown Windows 10 environment. I have 128 gigabytes of RAM here. I'm running a Xeon processor, and this is running a 64-bit version of Windows 10 Enterprise. And now I have full access to, either access a legacy Windows-based application, to access confidential patient data that's maybe in an application. And so, this is the same content that Frank shared earlier from the hub. I have access to it because he shared it with me, over OneDrive, and I can now see all of this content. I can also take this remote desktop app and actually span it across both screens. You can see that in this view, of course, the seam down the middle of the physical device actually shows up here. So it'll be a good experience for some of the content, but others maybe not so much, which is why enhanced apps are so important. But one thing I wanted to do now is actually switch over to, here I have the Your Phone app that allows me to do screen projection. And I'm just going to go ahead and exit that, and I'll try loading it one more time. Here we go. Minimize that. There we go. So now you can see my phone that I'm looking at. So I'm going to pull up that remote desktop app again. I'm going to span it across both screens. And you can see that in this view, you no longer have that seam down the middle of the device. And so I know within healthcare and thinking about, Windows Virtual Desktop or VDI solutions in general, it's extremely important for data security, but also allows devices that are also used for other things. There are maybe security concerns there to kind of be used as a thin client. In this example, I'm sharing my screen through the Your Phone app, but Surface Duo also supports via USB-C video out, and you can also hook up a wireless keyboard and mouse and have all of those experiences to be able to use and navigate around Surface Duo. So a great option for thin client as well. So I hope that those were a few quick examples of how, Surface Duo, thanks to the increased productivity with having two screens, really could help healthcare professionals across the industry better engage and ultimately care for patients to keep people well. Thanks so much, and I'll hand it back to Alfred so that we can go into the round table.
That was amazing. Thank you so much for sharing. And I appreciate the information that you shared. I actually have my own Surface Duo as well, so it's pretty nice to see and hear your explanation of it. And hopefully for the listeners that have had a chance to hear this conversation, you'll get a chance to actually go out and get your own Surface Duo. The productivity that is driven by it, absolutely amazing. I love it. I've been using it this whole time, so definitely we'll make sure that we share that. But we want to take this conversation a bit broader, right? We want to take this to the next level, because what we're thinking about is how do we take some of these solutions and build out a story, build out a framework around how driving collaboration in the evolving healthcare workplace works when you are working with several people. So we're bringing in a lot of our partners, and so the next phase of this is to really talk about some of the work we've already done with our teams and our customers to build out these solutions even before they return to the office. Taking advantage of several different types of technologies and building it out. So we've got the experts that are here to join us today, and I'm pretty excited to have them join us. So why don't we go ahead and do that intro so that we know exactly who they are. So we'll start with, let me just share this out so you guys can see it. Let me know if you can.
Yep, we got you.
Awesome. So, again, Alfred Ojukwu, we have three primary guests that are here, and I'll have them introduce themselves. We'll start off with Ollie Henderson. Oliver.
Hey guys, thanks very much for joining us today. My name's Ollie Henderson. I'm the Microsoft lead from Kinley. So the part that we play in a lot of these rollouts is helping you end users to get onto your team's path. And we'll do that in conjunction with Microsoft, and we'll use some very clever tools along the way, like those that are facilitated by our friends at Pexip.
Awesome. And next we have Kyle Forney.
Great. Hi, guys. I'm Kyle Forney. I'm the lead solution architect for the public sector at Pexip. And at Pexip, public sector means healthcare and federal government. So I do spend a lot of my time sort of in this space. Pexip is a technology company that does a lot with video, but what's germane to this conversation today is how we help organizations move to Teams faster. And we do that by helping legacy room systems get into Microsoft Teams, and so we'll kind of touch on that as we move forward here as well.
Excellent. And we've invited back our friend Sean. So Sean, you probably don't need an introduction, but feel free to share with them who you are again.
Okay, Sean Remackle, U.S. Provider CIO, background as a CIO in healthcare for over a decade, at Microsoft Health and Life Sciences for a decade. And just in case you don't know, Microsoft's a little company in Seattle that dabbles in technology.
Just a little company. But no, we love our partnership, right? And the reason why we say that is because we create solutions. We work with as a team to bring customers scenarios that work for them. And if I could tell you the work I've done with Pexip, the work we've done at Kinley in terms of collaboration and making sure customers are taking advantage of it, we'd be talking for days. But I want the experts to talk about this, and I want them to share their experiences. So we do have a number of questions, and we're going to kind of go around the room to have those conversations. But the first thing I want to mention is that we actually have a raffle. And the raffle itself is going to be for those that actually register for this webinar. So if you have friends, colleagues, other folks in the clinical space that know about this or may be busy, they still have time to join this webinar. Just go ahead and go to the registration site that we sent earlier and have them sign up. And we will announce the prize at the end of this. But please, this is a great conversation, so we're looking forward to hearing your thoughts. So I'll start with the first question. I'll just start with Ollie. So what trends are you seeing in your clients' return to work strategy today? What are you seeing today?
Yeah, there's straight down the line, there's a lot of confusion from people. People don't know when they're going back, when their organizations are fully returning to the office. But what we're involved with is lots of good, productive conversations. And the conversations will soon lead to decision making. And the conversations are all ultimately based around people having adopted a team strategy a lot more since COVID has been with us. So many of our clients pre-COVID were very much on a team's progression path, but this has been really accelerated because of COVID. And the benefits, if we can take anything out of COVID for our industry, is that people have become professionals at home. People have used Teams much more on their phone, on their desktop. Those that have been lucky enough have had Surface Hub 2s in executive home offices. So really, people are looking to make those changes and get the workplace ready to return as and when. Now, whether that's a full sort of snapshot back into the workplace is looking highly unlikely, and is looking much more like a phased return to the workplace.
Excellent.
Yep, I think that's really good. Can I go ahead and
yes,
jump
please.
there, Alfred?
Jump in there.
Okay, great. So to just kind of echo some of the stuff that was just said there, I think change management is sort of the name of the game for us as well. Ali had just pointed out that I think during COVID, I think the move over to Microsoft Teams was pushed to be a lot faster than maybe what some organizations were planning originally, which has been great in many ways. But when everyone's at home kind of working off of their Teams app on their on a laptop and everything, I think that that's a different story than when you start going back into the office and you say, okay, now that we're back in the office and we have these spaces that are kind of set up, we need to make sure that those are working as well. And I think, from the view of the world for Pexip anyway, the legacy room systems that are currently in place, so some of those meeting rooms that have kind of been closed and locked up for the last 6 months are now getting back opened again. And people who are going back to the office want to be able to leverage those. Obviously, it's one of the reasons why you're going in. So I think for us, it's basically conversations around change management. How do we make sure that those are safe? And then actually those technologies that are in those rooms, how do we make sure that the team's experience is the same as it was, or at least close to, as when they were home as well? So that's kind of one area that we are sort of focused right now.
That's interesting. And Sean, any thoughts around that as well?
Well, I mean, so the customers that I support, right, are typically pharma plans and providers, and each of them are pretty distinct, right? Providers, for the large part, didn't go anywhere because otherwise hospitals would have closed. So, it's really different. I'd say probably the explosion we saw specifically in the healthcare space, and especially in the provider space with Teams, is and around virtual visits for patient care. If you follow the line of the public health emergency, it matches it. In fact, most statistics out there around telehealth prior to the emergency, most customers were probably doing 10 to 20 virtual visits a week. Many of them peaked around 4,000 to 5,000 a week, and now they're down to around 900, depending on the state and area that you're in, right? So I think, customers, the technology really stepped into the gap for especially for the providers, and now, which is what typically happens when you have an emergency, now everybody's sorting out. So we butchered all of our business processes. We just tried to hang on and meet the tide. Now what? And so I think there's a real rationalization that's coming to these environments. How do people going to work in mixed environments? Will they? Maybe some doctors will be dedicated to telehealth and they won't go back and forth. So I think it's typical with any fast push. There's going to be a reconciliation about what the workflow and what the work looks like. And I'd say plans in pharma, most of them are still largely working at home, just because of the way their work is.
But I think what's interesting, a couple of points, just picking up on what the other guys have said on the panel. It's the range of inquiries we're starting to get. Companies are being super smart about their readoption into the workplace. I'm dealing with a current lead about Microsoft Teams Live. This is a large global company. They're having town hall events of up to 9,000 people, and they're forward thinking enough to start consulting us on how is that going to work when a lot of people are returning to their offices. How's the network infrastructure going to stand up when that many thousand people are streaming from one point? So kudos to the clients. Really, everyone is becoming more educated along the process. Other things that have been super helpful is MTR seems to have leapt forward leaps and bounds in the last 6 months. There's new products, new devices coming out, the collaboration bars, there's a lot of interest in those. People are wanting to see how quickly and in an agile manner they can roll out Teams rooms. And, for some of these global companies that we're dealing with, that's by the thousands.
No, I agree. And I think that's the piece that we have to sort of balance. And that kind of leads me on to the next question, right? So we think about this as being sort of this trend that's happening. You kind of look at my background, you love my lovely home here, and you see the others, they have, they're in the office, which is great as well. And the question that comes out of that is, do you think this is going to last? Is this just an effect of the pandemic that's just happening and it's just going to shut off? Or do you think it's actually going to continue for some time? And I'll throw that to anyone of you guys. So
I'll start because, I mean, meeting with executives, I think that there's a fair amount of turmoil with that. And I hate to say it's somewhat of the a condition of the executives because some people are pretty staid, right? They're pretty, they can't see that people working at home is effective. How do they measure productivity? Again, providers, hospitals, different story altogether. So there's I think I'll go back to one of the slides I mentioned, your culture is going to come from your leaders. If they're hesitant, they're used to walking into people's offices and having a conversation. I think you're going to have levels of resistance there. And I've seen it for some of my customers, right? It's been a painful transition. Others probably go too far the other way. I had someone the other day tell me that they want to get all patient interactions into telehealth. I worked in hospitals long enough to know that you're not going to do an orthopedic surgery remote. That's not going to happen. So I mean, we got to get to low acuity at best, right? So I think people see the commercials. They see what's going on. Some are dreamers. Some are classic, resistance people. And in between, I think people will work it out. But I think it's going to be highly individualist to the company and their leadership, and that's what we're seeing across the board. There's no one size fits all, even though analysts that are out there who write these things on a daily basis that make predictions about telehealth, I can tell you on the ground, that's not going to come true. That's not going to happen.
So yeah, echoing some of Sean's points, it's got to be the hottest topic out there at the moment, and we'd all be very rich guys if we had the answer to that, like as in here and now. Every morning you put on something like CNBC and looking at how the market's moving, they're asking this particular question. Who's going to go back? How quickly are they going to go back? And in what volume are they going to go back? And I think they're so dependent on industry. There's so many movable factors to that. I think from what we've seen with a lot of our clients, whether that's pharma or whether that's legal or any of the verticals that we deal with, they are definitely considering bringing back a phased approach, and coming back to the office will be more of an event. So let's say you used to go to the office 5 days a week. People are now ready to get out of the house, ready to get back to their workflow, but still pretty nervous, and also seeing some of the efficiencies of working from home. So what I see, much like what Sean's identifying, is a hybrid workflow whereby when you come into the event, it'll be much more collaborative. And when you come into the office, it'll be a much more collaborative event. And therefore, the tools such as Surface Hub 85, MTRs, all of the above will be collaboration tools where people will be able to kind of work together in highly equipped rooms. And then for the rest of the time, people will be working in a much more remote manner. Education bucks that trend a bit because, we're seeing in the education market, lots of Teams adoption, people really wanting to kind of get back into the classrooms as quick as they can. But obviously they are very, very tightly held by the stringent rules that the government is putting on them.
Yep, so that's all a good point. I think most of those points that I was probably going to bring up there have been said, but I think what we're talking about here is a justification basically for needing to go back to the office, right? I think for most people, it's, obvious that, there's a difference in being in person. It's good to be in person. You can work as a team. You can have conversations that you really can't have online all the time. Yet at the same moment, I think most people would tell you that they could probably do 50 to 60% of their jobs, just working from home as well. So there's some of that too. I think the businesses really need to take a look at what some of the tools are and some of the spaces that they have, and what, why do people actually have to come in for it as well.
So, and it sounds like to me, and again, I love all the answers you guys are giving. When we look at this scenario, it sounds like there seems to be sort of this need or this requirement to reevaluate or reassess that need for adjusting or balancing out what the work from home strategy is to the return to work strategy. Are you receiving a lot of those requests? And I think you guys kind of answered it, but I'm going to ask it again. How frequently are you having that request to help them plan out that adjustment strategy?
It's a daily request from, Kinley's the system integrator here. We are dealing with people that are asking us to look at their large office spaces, rooms that were, let's say, for example, 24-person boardrooms. It's just not going to happen anymore. You're not going to get 24 people around that same space. So people are looking to work with ourselves and consultants to divide up those rooms into more agile huddle spaces where people can collaborate and maybe only 3 people. You've got the advent of new technology coming into this space as well, with occupancy sensors that'll shut rooms down if a certain amount of people exceed the amount that is designated for that room. So, you know, it's a lot of hand-holding. A lot of people along the chain are feeling pressure on this. You know, you've got the HR element of it. You've got a moral element. You know, leadership is not comfortable to ask people to return to work, but they are trying to give them a helping hand. There's no doubt about that. You know, the economy needs a hug at the moment as well. But, you know, there's HR are involved. We're finding facilities are heavily involved. There's a big burden on facilities within these big organizations to make sure that everything's safe, and you know, a lot of inquiries on non-contact join, again, which is where Teams, launching everything from your phone, you can launch entire meetings from your phone and utilize the room structure as well.
No, great answer, and I love that as well. I think the question I'll also ask Kyle, I'll ask you, perhaps you might have some insight. I think Ali, you might have some expertise on this as well, but we're also seeing this need for executive office spaces, so home offices where people are actually building solutions, not in the office, but actually remote, so that they have the same experience working remotely as they do when they come into the office. So when we talk about the technology or the solution that goes into that, how much of that integration is important for those that are looking for that to happen? How much of that are you seeing and is relevant for what we're seeing now?
Well, we see it quite often, actually. I mean, I think overall what it tells you is that quality matters. Right, so you know, sometimes somebody's laptop webcam may not get the job done, even if they have a fancy webcam or something like that. You know, perhaps they need more than that, right? So certainly that's something that we see often now within the healthcare space, particularly those that are budget focused right now. You know, a lot of times what they'll do is they'll recycle maybe a room system that they currently had in place, and they'll try to get that to somebody's home and get that set up. But at the end of the day, that still needs to be able to work with Microsoft Teams, right? So, and that's one of the areas where, you know, we can certainly come in and help out with that. But yeah, I mean, absolutely, where quality matters, you know, quality room system, quality lighting, you know, we see that all the time.
And Alfred, I'll weigh in. I still think it comes down to people, process, and technology, almost for each person's responsibility. Like I have major health plans. It's not that they can't use Teams. It's just that the work that if you will, the line workers used isn't digital, or it's in a line of business system that they can't push out to them. So it's not that Teams doesn't work and they can't communicate and collaborate and maybe get used to it and find a way to work at home, but the back end systems that supply work is broken. Whereas your typical professional, maybe like a researcher, somebody like me who stands in front of computers and talks all day, people like that, easy adaptation, right? The work is in front of them. It's probably been digital for a long time. So, you know, I think the folks on the call have it right, is that it's awfully individual. Technology is a solution, but people and process have to be reworked as well.
We've seen a bit of a funny trend, which it does back up some of what Sean's saying in terms of, I think 18 months ago to a year ago, that, you know, there was a whole buzz about the democratization of collaboration. Everyone's got these tools at their fingertips, and everyone can join in, you know, at whatever stage along the life cycle. And you know, to Sean's point, realistically, that kind of can't always apply in this strange situation that we all find ourselves in. However, what we're also finding is there is a demand for the work from home toolkit, and then there's a demand for the executive work from home toolkit, whereby people are, you know, there's a lot of upper management with a lot of pressure on them to make sure that their execs can have global calls, earnings calls, you know, serious business getting done at the top. And these guys aren't particularly maybe as ultimately tech savvy as they'd like to be. So that the upper management has to make sure that within the homes of some of their very senior execs is the right solution. And one that's kind of derived as COVID's moved on, hand in hand with good timing, is finding Surface Hub 2 with a full Windows 10 experience on it. Now, again, talking about the cold hard facts of workflow, when a device gets into someone's home, it kind of steps out of the workflow a little bit. So even though you'll be using, say, Teams for 80% of the calls, someone may have a social Zoom call, someone may have a random GoToMeeting link. With that Surface Hub 2, we've found it kind of gets over all those obstacles just from an executive work from home level, and even taking on board something like Pexip's virtual meeting rooms, it can access that. So it's like a Swiss Army knife piece of hardware. It's one card, it's one tool, and also the guys that are actually maintaining and monitoring and looking after that, whether it's Kinley or the end user themselves, can set up permissions on that remotely.
I'm going to pick on one word that you said, which I thought was absolutely phenomenal: the Swiss Army knife of tools, right? And I think that's important, because what that says is that customers aren't necessarily looking for just a single a blade. They want multiple blades to be able to choose which one is best for which occasion, and they may be interacting with a number of different people. So, what that speaks to from my standpoint is, how do we keep them interested? How do we keep them focused on productivity? How do we keep them connected with the people that they're working with? How do we work with them in terms of collaboration? So, and this is a question probably for Sean, but we have employees that are getting this sort of stage of being lackadaisical and not necessarily feeling the same energy that they had when they went into the office, right? My question is too, is what are some strategies to keep the employees engaged and excited about what they do, even if they have to work from home?
Yeah, I think there's a lot of, in the physician space, right? We've changed even terminology. We used to talk about physicians' bedside manner. Now we talk about their website manner, right? So all this goes back to is you're changing your mode of thinking and how you're interacting with people. Managers who are walking around their employees and always checking on them, and they're pinging their employees nonstop. And I mentioned this a little bit in my best practices slide is, work out in the open. If you have I've managed a lot of people in my life, I think over 400. You find the styles of your employees, and you find your working style. And when you transition to a home worker, you can't be pestering them on IM. You can't be constantly trying to, throw keyboard loggers on, see if they're working. I know companies that are doing that. I think I've always followed personal philosophy. You have to treat people like a professional, treat them like you'd want to be treated. Unfortunately, in the workplace, that's not a particularly rampant phenomenon. There's a lot of bad managers out there. So I would tell you it's highly individualistic, but best practices are going to be give your people room, respect their time and place. And again, like I mentioned in one of my slides, encourage working in the open. When people are in an office setting, they talk and they look over each other's shoulders, and just the natural interactions brings things out. You still have to allow that from work from home. And if it's not happening and you're finding some of your employees not communicating, or they're not online, or other people can't really say what they're up to, got to do check-ins, right? Got to find out what the issue is. It could be depression. I mean, these things happen. Not everybody's suited for working at home because they might have a house that's not a friendly place. I mean, that happens.
But Sean, do you not think the Teams really, one of the golden nuggets of it, has been the game changer in that situation? It's so easy when everyone's sitting on the Teams platform just to pop an IM, just to ask a quick question, or Yammer further on from that.
It is, but if you're a piecemeal worker, like if you're processing claims at an insurance company, like that could be destructive to your work, your process, and you might actually get paid on how many claims you process in a day, right? So managers have to find a style or adapt to a style that works on the web, right? I mean, you don't want to have a camera on your employee all day. That's creepy, especially when they're on their home setting. They might have kids. Your husband may walk by after taking a shower. There's all kinds of things that make that kind of a different situation. It would never happen at work. So I wish there was a one size fits all and everybody was a good human being and a good manager. I could tell you, I'm 61. I've worked in management for a long time. That's not a true statement. A lot of people overmanage and so I think in the tele world, yes, the technology is wonderful. Not sure the people and the processes have changed, and so bad managers are still bad managers.
Right. So one of the things that I wanted to kind of throw in there as well is, although it may not necessarily be real time, I think, trying to leverage video as a medium for reaching out to people who work on your team is crucial. I remember I was living in Sydney, Australia a few years ago, and I was working with a large bank down there. And one of the things that their C-level did daily was they took a quick video shot and they threw it out on Yammer, and they threw it out there for their team. And I know Sean was going through earlier with some of their some of those case studies where they leverage Yammer and things like that. So you don't even necessarily have to use Teams per se. Microsoft has a whole suite of products that basically let you leverage video to get in front of your team and let them see your face, let them hear your message from your voice and not just from a note or something like that. So.
And have different types of meetings. I mean, I can even say for the Microsoft team, and all of us have been in the health and life sciences industry team, we've all been working home our whole careers. I mean, that's just the way it's always been. You're in a home office. But even for us, when the public health emergency hit, we now schedule a coffee talk. And it's works off limits, and we get together, we socialize, we turn video on, we goof around, we make jokes, we post funny gifs, we laugh at each other or with each other or about each other, and we make it lighthearted because you need some of that that energy. Everybody's at a different place, and being at home is not for everybody, right? Some people are being home their whole life. Like for me, I've been stuck here for various health reasons, so it can be quite challenging. So I think smart managers make time for different types of sessions. You obviously want to have team meetings, and then you want to have team meetings that are not about work. Let people be alive, let them be human.
No, that's a really good feedback and really good suggestion. And I think the other piece that I always kind of wonder about as well is the frontline worker, right? The scenario where the frontline worker has to essentially be the person staying involved, especially with healthcare. We see that happen quite a bit because you really don't have that, option to sit at home and relax unless you have vacation time or extra time. So how are we looking at that as a way to help them be productive, help them stay motivated to do the service that they do, right? How can we, what are some of those scenarios that you guys are seeing that help to blend that experience so that it has a better outcome for those frontline workers during their day-to-day?
I'll start. It has a lot to do with the frontline worker, and like again, what their task is. I've seen, like I said, I mentioned earlier, so this is probably repetitive, but a lot of companies who traditionally did not have a lot of digital processes are. I watch an IT people scramble to get Teams and Windows Virtual Desktop up and running. The problem is, again, technology can only solve so much on a bad, broken process. So they weren't ready for it. They had not considered it. In the provider space, there is definitely two worlds. Clinicians never really stayed home unless they were furloughed, and then like if you were in a same-day surgery, which was elective, yeah, you were probably sent home until they gave the all clear. But everybody else who's in the ICUs and the CCUs and the EDs, they were working. In fact, they'd like to go home. They've been working so much. So it just, I hate to say it's all very individualistic to the company and their situation, but it is. Not every group can function in away from work, and I'm not sure every manager is prepared for how that work gets pushed out and gets accounted for.
Agreed. No, this is good, and I think that's important to share that. And I'm going to kind of slowly edge over to our Q&A because I know we have some questions on the panel here on the live events, and I'll just throw it out. One of them that I thought was very interesting was asking a question around clinical trials, right? So we look at these technologies and how they're essentially helping to solve these challenges in healthcare and in the industry themselves. if you think about what a clinical trial is and what people do on a day-to-day basis, and again, Sean, feel free to jump in, or Ali, Kyle, what do you expect to see? How are our solutions helping to drive those sort of studies within the clinical trial space?
I think in its simplest form, the ability for people to have these collaboration technologies, whether it's Teams or whether Pexip has to give a helping hand to get everyone talking on the same platform, it's just allowing more. It's breaking down the geographical barriers, right? So time and geography suddenly doesn't become such a problem. And I think with it, if it was clinical trials just strictly looking at the US and you were talking East Coast to West Coast, I think with the technologies that we're dealing with here, that time barrier kind of relaxes. People are more inclined to get on a call slightly earlier to the West Coast or slightly later to the East Coast, and I think that's where Teams and or most video and collaboration technologies really helps out with that in the trials.
Yeah, I'll say, and typically in the industry, it's either virtual clinical trials, or they tend to use the word decentralized clinical trials as well. And it's kind of been an up and coming area anyway, because clinical trials are expensive to operate, and a lot of them were really up against the wall with the public health emergency. I'd say this: it's as I put out in the Q&A, it's typically a mix of technologies. You're not going to get away with just quote virtual visits. There's a piece of the process where that's going to work, but I see more and more interest in specialized bots that can check in with the patient on a regular scheduled basis, ask specific questions, and think of it this way: the bot is doing nothing more than separating the wheat from the chaff. If you're monitoring 10,000 people on a vaccine trial for COVID, or 30,000 people, that's a lot of touches. So you're going to want to try to automate that, especially when you don't really want to bring people back into maybe risky environments. So it's going to be separating the wheat from the chaff. The bot can lift up to the right person if there's a problem, and then we can decide if we need a virtual visit to have more of a deeper conversation about what's going on with a possible adverse reaction, or how the patient's just being monitored on a specific oncology drug. It could be a collaboration with a physician. So those video audio calls can be important, and observation of the patients, especially in some of the more high-end clinical trials. When I say high-end, I mean much more risky drugs, especially in the oncology cardiology space. Observation of patients can be incredibly important. And I won't say it's a substitute for a physical, but in this environment, it may be the best that you can do. So those patients are highly compromised, and you don't want them in a clinical setting if you can help it. And then lastly, I do see some of our customers moving into what I would call pretty sophisticated power apps. Again, this ability to capture data on a more around the clock basis. And I think you're seeing this also, some of it being done with IoT, right? More sensors on patients to monitor physical attributes, blood pressure, weight gain, things like that. So they're not dependent upon the trialists. I won't say people lie. That's not true. But I guess I'm trying to think of a better word. So that was a horrible thing to say, Sean. But what I'm saying is that the self-observations are not always true statements, right? Sometimes you need more observational clinical evidence rather than just someone's word for things. So if someone says, I stood on the scale today, what did you weigh? I know people who would go, I weigh 10 pounds less than I'm going to tell you, but that's not good in a clinical setting, right? So I would say there is no right or wrong answer for virtual clinical trials. It depends if you're a clinical research organization or if you're full pharma or whatever. But I think you're going to see a mix of technologies, and most of those flow back into a Teams environment. Ultimately, again, that hub experience.
Yep. And just one thing that I wanted to add there as well from a clinical standpoint on Teams. Earlier, Frank showed a really cool demo. They're using a Surface Hub as basically a cart, and that is very likely the future of the space. But the reality is right now a lot of these organizations may have several dozen, if not hundreds, of carts that maybe aren't necessarily Teams native on there, and that's an area where we can kind of come in and sort of help with that as well. So we have had some conversations around using some of those medical carts that are legacy carts and how do we actually use those in some of our trials to be able to bring those into teams as well. So that's something that we've been working on lately too.
And carts have been used heavily, or have been starting to be used heavily last over 2 years, especially in the clinical setting prior to the public health emergency, especially for like psychology, behavioral health, consulting. Typically, you assign like a psychologist or a psychologist to a oncology group. It's not uncommon to have a lot of depression type issues with oncology patients, but the coverage model is horrible, right? You might have one psychiatrist for 20 clinics. Those carts to do psychological and evaluations or have conversations with patients, really important. You can spread the work much more effectively and schedule it.
That's great. No, and it's good to see that momentum happening. And one last question, and we have a surprise demo for you guys in a second. But this is a question I think each one of you guys may be able to answer, and it really goes back to somebody that's running their business, whether it's the clinical business, whether it's the provider, the payer space. What's one piece of advice that you would want to give them as they prepare and move forward with this whole change in work-life balance, etc.? What's one piece of advice from a collaboration standpoint that you'd want to give them in terms of taking advantage of, building the right solution for their employees, whether they're working from home or remote? What would be that one, golden nugget? And I'll start with Ollie, then Kyle, then Sean.
Don't be too reactionary or knee-jerk. I think a lot of people I'm speaking to are considering multi-million-dollar decisions based on not too much data or just what we've become used to in the last 6 months. Don't try not to fully deviate from your workflow. Say if you're migrating to Teams and there's a few thousand Zoom users floating in, be solid with your direction. Don't try and be all things to all men. Yes, we do have to adapt and modify, but don't kind of try to cover every base to work out 6 months time. Some of the solutions we were looking at weren't ready enterprise ready. That's what I'd say.
Yep, that's a great point there. And the one thing that I would say is to make sure to keep the processes simple. Make sure people can get in and out of sessions very quickly. I think one of the things that I've noticed within the last several months here is there's been kind of a revisit on making sure that virtual meetings are a bit more structured than I think culturally as a whole they were prior to COVID. So when folks start to sort of venture back into the office and they start to use maybe some of those conference rooms and things like that, they don't need, you really can't be sitting around for 10-15 minutes trying to fuss around with a room system to try to get in. So whatever it is that you're doing, whatever the actual process is, make it very, very simple for people to get in and out so that they can keep on time.
Okay, so I feel like this is a trick question from Alfred for me, but so one thing that I would recommend, let's see, Alfred, I will say purchase Microsoft 365 with Teams and get a Surface device. I think that's the correct answer for me.
No, think a bit more broadly, Sean. No.
Listen, I've been in leadership as an executive in healthcare for quite a long time, and I think leadership is everything. I'm a big believer, not in managing, but in leading. And so I'll come back to a theme I've been beating on here. But it's very, very similar to the conversations that have been here in front of me, but it's about leadership. If you don't establish it, you don't set a culture for it, you don't build upon it, and you don't execute on it, you won't have it. And it'll all fall down. And you're going to have people who are being forced to work at home who will abandon your company and they were good employees, and vice versa. So if it's not thoughtful, it's not encouraged, you don't bring it into your culture, then I don't think it matters what happens down below, because the winds will shift again.
Great advice. Great advice. I'm over here taking notes in my Duo, like, okay, make sure I follow up with these guys. This is great. And just really quick, if they need to get in contact with you guys, I'm assuming you guys are all on LinkedIn and they can reach out to you, Ollie, Colin, Sean?
Yeah. Yep. Always open channel of dialogue at all times.
Amazing content, amazing information. I just want to say thank you again. for the information, but we have one surprise for you guys. You know, one of the things that we talked about were functionality that allows you to be more agile. One of the things that we've done with our technology is, you know, provide more of a solution-based framework for it. And I think we have Frank on the line here, ready to show you a few things real quick. So Frank, whenever you're ready.
Yeah, I'm ready. So thanks, Al. So what I want to talk about as we finish up here, and there was a mention around bringing Agile and having greater functionality even on the Surface Hub product line. I'm reminded of this last week. I had a tree that went down in my backyard, and you know what I learned very quickly about a tree going down is you got to have the right tool for the job. Right, we were able to clip the branches off with some trimmers, but then in order to cut the wood, I had to go borrow a chainsaw from a neighbor. But then what I quickly learned is if I wanted to get that root out of the actual ground, I actually needed to go buy a sawzall. And I was actually pretty happy about that because I was able to convince my wife that I'll get that root out of the ground with a sawzall rather than hiring somebody to come get it out of the ground. But the reason I needed the sawzall is because the chainsaw will actually bind down if it hits dirt and actually ruin the blade. So having the right tool for the job really makes an amazing difference, right? Having the right tool, whether that's a Surface Duo in this particular case, or even if I'm usually getting my work done, and how I get a lot of my work done is through more of a tablet-based device. I'm in marketing. I use this tablet-based device in order to do emails, or do things like create PowerPoints. That's what I do in marketing. But the other thing I do is make presentations. And so this is not a great device, I think, for making presentations where the Surface Hub actually is. And so if I look at the Surface Hub in this particular case, we've done one thing on this hub that's a little different than others. A couple weeks ago, we announced that we can now run Windows 10 Pro on Surface Hub. That's the ability to run the same operating system that you normally run on your desktop, hopefully, and you can actually run it on a Surface Hub. Now, the Surface Hub running Windows 10 Pro is not a great operating system, in this case, for meetings when it comes to groups. And the reason is if I was to lock this device, in this case, and I'll come in here and hit lock, you'll see that it goes into a lock screen, but in order to get out of the lock screen, I have to authenticate to the device. Now, the Windows 10 Team OS that runs on the standard versions of Surface Hub, it allows you to have a walk up and use experience where you don't have to authenticate to the device in order to use it. But in order for me to get to my own device and my own kind of capabilities of OneDrive and Outlook and all these different pieces, I have to authenticate. Well, we added in a fingerprint reader to the Surface Hub so that I could simply walk up to the Surface Hub, put my finger against the fingerprint reader, and it will actually log me straight into the device. The device has a high level of security. Essentially, there's a TPM chip that encrypts my biometric on my fingerprint and stores it in an encrypted vault on the device. But now I'm able to get to my Outlook. So here's my Outlook. Here's that patient record that we used in the past. But also I can actually get to my Teams environment. And so you would say, why is this the right tool for the job? Well, in this case, I can actually use this device to get up on my feet and actually interact. And imagine I'm a physician or a clinician that wants to work with a bunch of patients that are remote. I want to be able to see more detail. I want to be able to use this beautiful 4K device in order to see the patients that I'm interacting with. So in this case, I could come up to Teams and hit Join Meeting. And when I hit Join Meeting, it will actually join me straight into this meeting. I have to come in and do a quick accept on this other device, I think. Oh, I just have to pick how I want to join. So I have to join. So it'll join the meeting. It'll say, let me in. And so within here, I'm now able to actually join this same meeting that I had before. And I'm able to now have these folks, in this case, other physicians that are on television, that I can actually interact with. But the cool thing that I could do is imagine this is a patient, right? And this is a patient that I want to interact with, or other physicians. I could take this content, dock it off to the side of the screen, and then be able to bring up, say, something like a Word document, or in this case, that patient record, and be able to dock this onto the other side of the screen. And now I have this ability to view the patient records, view the physicians, and be able to have this level of interaction towards how I want to get work done. This way that I can actually see them. It looks more realistic. I'm not looking at them through a small 12-inch screen. And you could say, well, Frank, you could just project to a larger LCD. But with a larger LCD, I can't use pen and touch. And I can't use my own single Surface Slim pen. The right tool for the job really comes into play here. So I could do things like going out to the Microsoft whiteboard and be able to whiteboard with my fellow physicians or clinicians that are out there and be able to kind of get this work done. Then when I'm done, I can actually just leave the call and be be able to use the device in other ways in order to get my work done, or maybe I'm not going to use this device and I'm going to go back to my more handheld device in order to get more of that productivity level work done as well. So I am able to use this right tool for the job, but also have this ability to have this walk up and use and fingerprint sign on and have this device have my own individual experience. This is great for working from home, or even in having this in your own personal office, and ways that maybe educators can work with their broad student environment. There's a great presentation that we actually did at Ignite where we focus on a professor down in Australia, Herb Kellerman, who teaches mechanical engineering to his students, but he teaches it all through running Windows 10 Pro on his Surface Hub, and he's able to engage with them. The line that I love that he said was that everybody has a front row seat in his classroom, meaning that everybody is now in the front of the class that can see him clearly, but he can also interact with them. And he says he gets actually a much more higher level of interaction through chat than he ever got with his students before when they were just sitting in the classroom because of maybe different things along embarrassment over asking questions and different pieces. And so for him to have everybody have a front row seat really makes a big statement. So with that, I'm going to call it a day and hand it back to Alfred, but we just wanted to showcase this ability of having your own individual experience on Surface Hub and then having the right tool for the job in order to get your work done. Back to you, Alfred.
Thanks, Frank. Thank you. Great content. And I can't even believe we've gone over about 2 hours worth of information. Hopefully the information we've shared is helpful for you, your organization, and any planning that you're doing as part of your build out, especially with this remote collaboration strategy. I also want to send a big shout out to our Pexip team behind the scenes. It takes a lot of work to put this together. They've done a great job of providing steps on how to integrate the products together and make a solution that helps customers take advantage of their existing investments. And we partner with them because it's important that we have that collaboration happening. So great, big shout out to Pexip and Kyle and his team for doing such a great job so far. Also, a big shout out to Kinley for everything they've done. They are our partner, one of our partners of choice that really help to accelerate the AV and collaboration space. They have solutions that help you reduce cost and overall strategy from a work from home strategy. And again, our drive working with Sean and behind the scenes, Sam, probably haven't met her yet, but she's been doing a great job so far. We want to help you provide healthcare solutions, things that help you to be more productive, whether you're a frontline worker or whether you're a remote worker or an executive. We want you to really think about what you want to do. And from the wise words of, I believe my friend Oliver Henderson, he says, think first. Before you make a move, before you make a decision, before you make a commitment, we want you to come to us. Think through what you're trying to do, how you're trying to do it, and what makes the most sense. That's probably the most important thing that we can say. And again, just want to say thank you for being a part of this. The last portion of this that I want to share with the team is that we do have a raffle prize, and it's a Surface Pro 7. So if you have signed up for this registration and you were part of this, you are part of that raffle, and we will be selecting that name and providing an email information to that individual, whoever that person is, that they actually won the raffle. So again, we would like to invite you to continue coming to these sessions. It's important for us to be part of your learning, your journey, and feel free to reach out to any one of us. Thank you again, and have an amazing day.